Hey everyone, happy 2024. Welcome to the January safety meeting. Yay! Okay, so today we're going to talk about a couple things. We're going to do our monthly safety meeting and we're going to talk about 3 protocols in your office. So, first thing is we're going to talk about a medical emergency. So today's medical emergency is chest pain or angina. Most important, which I always say, is know your patient, right? So the first thing you need to do is know the patient's medical history with anything that they have, right? So any patient that has medication that they take on a regular basis or an emergency basis as needed, they should bring their own with them. So if you have a patient, you should know they come in and they have a history of angina. You should know that they take nitroglycerin, that after 2 minutes it goes away or whatever, whatever their symptoms are, so that you can know and compare to what's happening in your office. So someone comes in with chest pain, it's a patient that has angina. What you should do is ask them if they brought their nitroglycerin. If they did, have them take it. Grab your medical emergency book or go into the portal and find your medical emergency book. So we're going to go into the portal and find it right now. So here's the portal. This is my last month's update. So we're going to search for medical emergency. We're going to the book. So in this is the medical emergency book, which is all you all have a hard copy of it. And you can download it or you can search in here for what you do. So this is important just to know that it's there. Obviously the reason we're doing this today is so that you can know in advance what to do. So you don't have to go to the medical emergency book and take all that time to do it. So if you have a patient that comes in with chest pain, you know that they have angina, you ask them if they brought their nitroglycerin with them. Nitroglycerin can be in 2 different forms. It can be in the pill form like this, or it can be in the liquid form like this. It's either or, right? You're not going to give someone both, but if they take it, you see if it goes away, if their chest pain goes away and it's normal and how they normally, their symptoms last. In here, it talks about if you go to chest pain, it will tell you how much you can give someone. This is also in the book on the screen. So everything's sublingual, right? So you can give 1 tablet every 5 minutes, up to 3 tablets in 15 minutes, or 1 to 2 sprays, up to 3 sprays in 15 minutes. But if somebody has angina and you know that their story is it always goes away after 2 minutes, and this is 2.5 minutes or 3 minutes or something's different, you call 911. Someone goes and gets the AED, because anytime someone has chest pain, you want to have the AED on hand, because we all know that's life-saving. If the person doesn't have their own nitroglycerin, you go and get your emergency kit so that you can have your nitroglycerin. But the AED is what is really important. If the patient, again, if this is not normal for them, or they have never had any kind of chest pain before, you grab the AED, you have someone stay with them, you have someone else call 911, and you monitor them and see how they're doing. So kind of go over that a little bit in your office and make sure you guys all know where the AED is and where all the other things are. But that's chest pain or angina. All right, number 2, we're going to go over the respiratory protection program. So how you find everything in here is searching for it. So you search up respiratory, and under here in protocols, it has a respiratory protection program. So you can look at it. It's very exciting. It basically talks about what you need to do to keep, your nose and your mouth protected, respirations, right, during procedures and in the office. What you do want to do, though, is there is a map that I like to search for. I just look up COVID map tracker. And you go down here to maps. And then what you do is you look at your part of the country, right? And if it's in green, you're good. If it's in yellow, there's an iffy amount of COVID in your area. And then in orange, there's a lot of COVID in your area. What the CDC and OSHA want you to do for respiratory protection is that if your country or your part of your county, your part of the country is in orange, they want you to wear an N95 for aerosol producing procedures. So the only way that you can wear an N95 is if you have been fit tested. because everyone's face is different. In an emergency, when you need an N95 and you want that extra protection, it's useless to just pop one on, hoping for extra protection when you don't know if it fits. So it is an OSHA requirement to every year be fit tested. You also want to know what you have in your office, right? That you have something that fits, what stock you have. If you need help, you can call us, we can fit test you. So fit testing comes with also a medical clearance. Every clinical person has to have medical clearance, and that's really easy to do. You just call your doctor and say, send me a little letter that says I'm healthy enough to wear an N95, and that's a one-time deal. So that's what respiratory protection program is. You can kind of scroll through it. It's a wonderful read. But it's fit testing is really important. It does have value if you do want to wear an N95. So the next thing we're going to go over is laundry. So you search for laundry. You have to kind of scroll down here a little bit, and you want to go to the SOPs. And in here, it has a couple different options. So if you have disposable gowns, really easy. You just throw them out, right? Go in the regular trash, obviously, unless they're blood soak or something. Then reusable is where it gets a little confusing. So if you have laundry that is being laundered by a company, you need to make sure that that company has OSHA training, bloodborne pathogen training. It has to be in and hamper the laundry, and it has to be labeled with a biohazard sticker. And then it should also be in an area that's not contaminating the clean laundry. So that's one thing about laundry. If you were doing laundry on site, this is more of what that is. It explains how, you really want to think about cross-contamination and not having, touching the laundry with gloves, and then touching the, the washer or the dryer, and then, taking it out and then touching the dirty thing again. You really want to be really aware of, what you're touching and what you're not touching. So just make sure that you're doing that, and go over what your policy is in the office for laundry. All right. Then number 3 is we're going to talk about medical waste. So we're going to go to the ECP. So that's the OSHA book. This has really good information about waste. You have to download it. So you would click on download, and then you can go and, click on whatever you want to get to that. So I'm going to click on waste. So basically what medical waste is anything that is blood or saliva soaked. So that means you would squeeze it and blood or saliva would drip out of it. That's potentially contaminated, or something sharp. So anything of the potential of causing you harm is a medical waste. So basically what you want to focus on medical waste is putting as fast as you can, not racing and hurting yourself, but immediately after use, putting sharps in sharps containers, putting blood soaked gauze or stuff in biohazard bags or sharps containers. Always making sure that the sharps containers are not overfilled. I see a lot overfilled. You don't want them to be hazardous for you to put something in there that you might get poked or whatever. Also making sure you keep the caps on them. A lot of times I see people opening them up so that it's easier to put stuff in, but the cap that it has on it should always be on it. And when you transport it, you always put the extra cap on and shut that and make sure that that's on it. So the other thing is you should know who your medical waste company is, who transports it. And every time that you have it leave your facility, you need to have a record of that. And there's a form in the portal too that you just look up medical waste removal. And that is it. That is your safety meeting for the month of January. So if you can make sure that you go over your policies, know where your AED is, know where your emergency kit is, know, where your sharps containers are, what you guys do for laundry, where you have N95, where if you've done your fit testing, and double check that you're all set, and then everybody signed that they have listened to the meeting and you are good to go. All right. As always, reach out with any questions. Thanks.